Hey everyone, welcome back to my channel. Welcome to another edition of Health Class. So I've decided to postpone my Christmas disease video because I want to discuss about brain aneurysm. As you know, a popular singer in the Philippines passed away very recently, JOVIT BALDIVINO, and I know the whole of the Philippines and all of the Filipinos know about this singer. We will be discussing about brain aneurysm. What are the causes? What are the triggers? How do you treat brain aneurysm? And when to speak to your doctor if you suspect that you have brain aneurysm. If you want to know more, keep on watching. My name is Ryan and I'm specializing in diabetes, men's sexual health, primary care, and alcohol and drugs. But first of all, my deepest condolences to the family of JOVIT Valdivino, his relatives, friends, and fans all over the world. So let's get started. So the story was, JOVIT was performing for his friend. He sang 3 songs, and after the 3rd song, he became unwell, which prompted the family to send him to the hospital. He was admitted in the ICU and comatose for a few days. According to reports, JOVIT had brain aneurysm. What is brain aneurysm? Brain aneurysm is a weakness in a blood vessel or vein in the brain that balloons up or that blows up and fills with blood. It develops as a result of thinning of artery walls. And although it can appear anywhere in the brain, they are mostly common in the arteries at the base of the brain. Most intracranial aneurysms occur between the underside of the brain and the base of the skull. The aneurysm can leak or rupture, causing life-threatening bleeding. And that's the danger there. If the aneurysm ruptures, it will cause hemorrhage or bleeding, and that is life-threatening. On the other hand, an unruptured aneurysm causes no symptoms. That means if the aneurysm hasn't ruptured, you may not feel any symptoms at all. A key symptom of a ruptured aneurysm is a sudden and severe headache. That means you will just experience a severe headache out of nowhere. An aneurysm often looks like a berry hanging on a stem. If an aneurysm leaks or ruptures, causing bleeding into the brain, we call it hemorrhagic stroke. This quickly becomes life-threatening and requires prompt medical treatment. So if you suddenly experience a very severe headache, or if you know someone who suddenly experienced severe headache, then you need to go to the hospital, or you need to send this person to the hospital for immediate medical treatment. What are the signs and symptoms? The signs and symptoms of a ruptured and unruptured aneurysm are slightly different. A larger unruptured aneurysm may press on brain tissues and nerves, causing pain above and back of the eye, a dilated pupil, a change in vision, numbness of one side of the face. Sometimes people may experience facial drooping. That means weakness on one side of the face. And according to the reports, when JOVIT finished singing the 3rd song, his face looked different and he started drooling of saliva. For ruptured aneurysm, the signs and symptoms are sudden severe headache, which is the key symptoms of a ruptured aneurysm, nausea and vomiting, stiff neck, blurred vision or double vision, sensitivity to light, seizure, a drooping eyelid, confusion, and loss of consciousness. You might be wondering, what are the risk factors of brain aneurysm? Well, we have a few. Older age, people who are a little bit older, they are at risk. People who are cigarette smoking, people who have high blood pressure, people who are using drugs such as cocaine, those who are drinking alcoholic beverage heavily. Women are more at risk than men. It is also genetics. If it runs in the family, then you will be at risk. Sometimes after a head injury or blood infections. So if someone in the family has brain aneurysms, then you are at risk. You need to speak to your doctor in order for the doctor to keep an eye on yourself and your health. There are a lot of ways to prevent brain aneurysm from happening, and there's a lot of ways to prevent brain aneurysm to rupture. So how do doctors diagnose brain aneurysm? There are a few tests that they can do to find out if you have brain aneurysm, and most of these tests are imaging. One of the common tests is CT scan or computerized tomography scan. It is a specialized X-ray and is usually the first test used to determine if there is bleeding in the brain. They may inject a dye that makes it easier to observe blood flow in the brain. A lot of people as well are allergic to dye. So if you are allergic to dye, you need to tell your doctor or the radiologist so that they will avoid injecting dye, because we don't want any allergic reactions or anaphylaxis. And that's dangerous too. There is also CSF test or cerebrospinal fluid test. If there's a subarachnoid bleeding, there will most likely red blood cells in the fluid surrounding the brain and spine. A procedure called lumbar puncture is usually done. This is done by taking a sample of the cerebrospinal fluid from your back with a needle, and that fluid will be tested for the presence of red blood cells. MRI or magnetic resonance imaging can be used as well to detect brain aneurysm. MRI uses magnetic field and radio waves to create detailed images of the brain. We also have cerebral angiogram. A thin, flexible tube or catheter is inserted into a large artery, usually in the groin or the wrist. It goes past your heart, then to your brain arteries. A dye is injected that travels to brain arteries. And again, if you are allergic to dye, you need to speak to your doctor. You need to tell your doctor and the radiologist that you are allergic to dye and you can't have dye. What are the treatments? We have 2 surgical treatments for brain aneurysm. Let's discuss each one of them. So we have surgical clippings. This is done to close off an aneurysm. A section of the skull is removed, then this provides access to the affected vessel or vein. Then a tiny metal clip is placed on the neck of the aneurysm to stop the blood flow. We also have endovascular treatment. This is less invasive than the surgical clipping. A catheter is inserted into an artery, then a flow diverter or disruptor or stent or combinations are used to destroy the aneurysm. Then we have oral medications treatments such as painkillers to treat the pain. We have hypertension or blood pressure medications to make sure that your blood pressure is controlled, calcium channel blockers tablets, as well as anti-seizure tablets. But the most important management in order for people to avoid brain aneurysm is lifestyle modification. If you smoke cigarette, then you need to stop smoking. There's a lot of options out there that will help you to quit smoking in a healthy way. You need to speak to your doctor about the options that you can have. If you drink alcohol, then you need to start thinking about limiting, reducing drinking alcohol. You need to make sure that your blood pressure is well controlled. If you are taking blood pressure medication, you need to take these tablets religiously. A lot of people are not taking their medications regularly, resulting to their blood pressure to be unstable. It is very important for your blood pressure to be controlled and stable. Don't use drugs. Don't use cocaine. Don't use heroin. Don't use cannabis if it's not for medicinal purposes. You need to speak to your doctor if you are drug dependent, there's a lot of treatments out there. There's a lot of rehabilitation options out there. Then exercise. Exercise is very important because it keeps you active. It keeps you healthy. It keeps you fit. Then diet. It is very important to watch the food that you eat. Whatever you put in your mouth will go into digestion and it will be used as a fuel for your body. So if you are consuming high fat diet, high cholesterol diet, then it will not do good for your health. Let's watch the last performance of JOVIT BALDIVINO before he was sent to the hospital. JOVIT, may you rest in peace, rest in paradise. That's all for today, guys. Thank you for watching my video. I hope I'll see you again on my next video. Stay safe, be healthy.